Whether you're dialing in today from Southeast Asia or Africa, Burundi, or the Bronx, the past 3 years have tested us all. The COVID-19 pandemic placed enormous strain on our health systems and widened longstanding health inequities. It also shined a light on the critical role of community health workers in treatment testing and vaccine rollout, and showed that when equipped, community health workers maintain access to essential care, even in times of great disruption. As we emerge from the COVID pandemic, we have a critical opportunity to invest in this approach to care that can save the lives of millions of people every single day and provide the critical surveillance needed to prevent the next pandemic. Today, you're going to hear about our forward-looking ambitions to close the distance to care for last mile communities. I personally could not be more proud of the work that we are planning. And you're going to hear about our expanded work to make professional community health workers the norm across the continent of Africa through deep partnership with ministries of health, many of whom are on the line today, and work to influence more than $2 billion in funding flows. But first, I'd like to start by grounding us in the roots of last mile health and our journey to this moment. Our work started in Liberia's remote rainforest communities 15 years ago to rectify an injustice. Patients were being denied the essential right to health care solely due to distance. What that meant is that if your child woke up with a fever in a community in remote Konobo district, you would need to carry her down paths cut through the rainforest and on canoes down rivers to reach the nearest clinic, a journey that could take hours or even days. And this was the reality for an estimated 2 billion people around the world who live beyond the reach of the health system. Last Mile Health was founded to bring care closer to remote communities, and that has driven every decision that we've made over the past 15 years. We have learned that you can close the distance for patients when you invest in community health workers and the systems that enabled their success. We know that to be effective, community health workers need to be integrated into the broader health system. So a critical milestone over the past 15 years was scaling from a pilot program of 42 community health workers in Konobo district to partnering with the government of Liberia to launch a national program that now employs over 4,000 professional community health workers to deliver care to nearly 1 million people. I'd like to share a glimpse of the day-to-day experience of 3 of these incredible health workers, Serena Kun, Diana Dennis, and Emmanuel Miller now.
I'm Serena Kun. I'm a community health worker in Solo Village. I'm here to make sure that my community members access health care. Hi, also. Yes, come up, problem. Did you know here? And spend time with you. And you will feel away by the I do active case finding. I go to my community and ask them how they are doing. Try giving them medicine. If something happens in my community, I will know. When somebody dies in my catchment, I know. When somebody gave birth in my catchment, I know.
What's the milligram you're treating her with? You say she 1 year, right?
Yes, I'm treating her with 50 milligrams.
50 milligram what?
Of the ACT.
Okay. I'm Dana Dennis from RTI, Upper Yanning District. I supervise the community health assistant.
I'm Emmanuel Miller. I work for Last Mile Health as a community health service supervisor in Bojiwon.
The training that these folks receive covers everything from tracking the next Ebola, the next disease outbreak, to treating children for malaria, diarrhea, pneumonia, and malnutrition, 4 of the most devastating diseases that contribute to child mortality.
One of my biggest challenges is that my communities are far apart and I have to walk a very long way. I have to ride a very long way before I can get to one community.
It was very difficult, especially with the rainy season in Liberia now. Walking through the very small path, you have a lot of water. Sometimes you have cassava snakes. Sometimes you are sliding, you are falling. It's very tough. For some days you have like 6 creeks to cross, and some days you won't cross at all. because the water will be filled all in the forest, and you cannot attempt. You'll be taking risk. It's not very easy.
Liberian health workers like Serena, Diana, and Emmanuel have achieved incredible impact in Liberia in a very short time. Like Emmanuel was just saying, it is not always easy. It's not easy-o. Since 2016, they've overcome challenges like the ones you just heard about to conduct 8 million home visits and deliver more than 900,000 treatments to children under 5 for malaria, diarrhea, and pneumonia. And with the support of the program, facility-based delivery rates for mothers have increased dramatically. Among women who gave birth in remote Riverside County in 2015, only 52% delivered in a health facility. By 2021, the figure had risen to 93%. And Liberia is not alone. The impact of professional community health workers is indisputable. The question of why community health is now firmly answered. The question before us now is how. How do we scale this proven solution to help achieve universal health coverage and ensure that no one dies simply because of where they live? The governments of each of the 4 countries where we now work, in Ethiopia, Liberia, Malawi, and Sierra Leone, are all committed to building strong, exemplar community health systems that realize this promise. Together, we are partnering to build systems that equip professional community health workers to save lives and advance the health security of each and every one of us. And as we partner with governments, we also realize we need to tackle challenges that stem from how international funding flows and how policies are designed. This is where we're turning our attention next, which is something you'll hear more about in the next hour. And it's important to remember that all of this work at the community, county, national, regional, and global levels is done with an enduring focus on that patient out there who needs access to care. 15 years ago, we were founded to bring care within reach of all patients. That remains our North Star. Personally, I am really energized by the work ahead, and I'm excited to pass it over to my colleagues to share more. I would like to first introduce Dr. Olusoji Adeyi, our incoming board chairperson. Soji is an expert with decades of experience in the global health field. He is president of Resilient Health Systems, the former director of Health, Nutrition, and Population Global Practice at the World Bank Group, and the author of the terrific book, Global Health and Practice, Investing Amid Pandemics, Denial of Evidence, and Neodependency. Soji, we are so fortunate for your leadership and your contributions to Last Mile Health. Very happy to turn it over to you.
Thank you, Lisha. Hello, everyone, and it's great to be with you all today. I'm a member of Last Mile Health Board of Directors, and I'm delighted to be the incoming chair of the board. I first encountered Last Mile Health while responding to the Ebola epidemic in West Africa back in 2014. In a crisis environment flooded by dozens of NGOs, Last Mile Health stood out for their effective partnership with the government of Liberia and for their relentless focus on reaching underserved and marginalized communities to stop that outbreak. Now, after Ebola, I continued to follow the work of Last Mile Health with great interest, and I was delighted to join their board nearly 2 years ago. The mission of Last Mile Health is essential to humanity's progress. How so, one might ask? During over 30 years working in global health, I have seen community health workers provide the care that patients need, especially in rural areas that are all too often neglected by those in power because of distance and because they are politically invisible. Last Mile Health is spearheading the movement to professionalize community health workers, build resilient health systems, drive more resources to community health, and ultimately transform the lives of millions of patients living in rural and remote communities. This is a daring quest, whose success on a large scale is not guaranteed. But it is the right thing to do. It is also the wise thing to do. At a time when 2 billion people lack access to basic health care due to distance, and at a time we continue to face a pandemic, investing in community health is a bedrock of a fairer and more effective health systems. And I will emphasize those two qualities: fairness and effectiveness in health systems. Now, Last Mile Health is well equipped to make a unique and enduring impact in this space. How so? First, over the last 15 years, they have demonstrated a consistent commitment to the gritty work needed to make progress. This is true whether they were building supply chains capable of delivering medicines, or salaries and technology to remote communities, or accompanying governments through political upheavals and economic crisis. The work to cover the last mile is not for the faint-hearted. As you heard from Emmanuel and Diana, there are many rivers to cross, literally. And this requires creativity and persistence. It requires a sense of mission. It requires a sense of duty. And those Last Mile Health have in abundance. And what is this, all of this without government ownership? Last Mile Health always ensures the government truly is in the driver's seat, and they work with the government of Liberia and allyship to the governments of Sierra Leone, Malawi, and Ethiopia, demonstrate how to make incremental progress day after day amid great challenges. So like Lisha, I am energized by the work ahead, and I'm very hopeful for what the next 5 years will bring. I will pass it over now to Mallika Raghavan, Last Mile Health Deputy Chief Program Officer, to introduce the new strategy. Mallika, over to you.
Thank you, Soji. Hi, all. It's wonderful to join you today. Thank you for being with us. My name is Mallika Raghavan. I'm our Deputy Chief Program Officer at Last Mile Health. I'm excited to be speaking with you today as I mark 8 years at the organization and have watched our work grow and evolve over the years. First, from our pilot and demonstration work in Grand Jide, Liberia, to the scale of the National Community Health Assistant Program alongside the Ministry of Health in Liberia. Now to our work across 3 new geographies in Ethiopia, Malawi, and Sierra Leone over the last few years. As Last Mile Health marks its launch into our new strategic cycle, the coming years mark an important focus on depth, quality, and government partnership. I would like to start by grounding us in the deep and urgent need for this work. Nearly 9 million people around the world continue to die each year from preventable causes simply because of where they live. And health inequity is especially acute in rural and remote communities. We know that community health workers can close the distance to care. Community health worker programs reduce maternal and child mortality, offer crucial pandemic surveillance and response, and have a return on investment as high as 10 to 1. Scaling this solution starts with ensuring community health systems have the 6 S's. To maximize their potential, community health workers need to be skilled, supplied, supervised, and salaried by a well-functioning community health system, operating at national scale and integrated into broader public systems via data and financing. To realize our vision of a health worker within reach of everyone, everywhere, we aim to make these 6 S's the norm for community health delivery in Africa, through direct accompaniment to governments and through regional and global advocacy. To maximize our impact over the next 5 years, we will guide our growth along 4 pillars. First, to deepen our accompaniment of national government and tailor our work to the needs of the Ministry of Health and other health leaders in each country. Second, to evaluate the impact of last mile health's accompaniment on community health outcomes, systems, and costs to generate evidence and insights. Third, to influence community health system funding and practice across sub-Saharan Africa to remove barriers and speed up progress. And last, to mature our organization through continued investment in our internal capacity and organizational effectiveness. All of this work will be done in service to patients like Marie Boto and her son Samuel, who at 17 months old recently came down with his third bout of malaria. The nearest health clinic was a 2-day journey. Fortunately, their community health worker, Laura, was able to treat him right in his own home. For the next half hour, we'll dive into 3 of these pillars and how we're putting this work into action. We'll explore our accompaniment to governments, our commitment to improving funding flows through the Africa Frontline First initiative, and about our new global office in Ghana. First, I'd like to introduce my colleague, Abraham Zerihun, our country director in Ethiopia. We're going to dive a bit deeper into our work to accompany national governments. Abraham leads Last Mile Health's work with the Ethiopia Ministry of Health to improve training and supervision for the country's 40,000 community health workers, also known as health extension workers. Before joining Last Mile Health, Abraham worked at UNAIDS, the Clinton Health Access Initiative, Yale University, and the Children's Investment Fund Foundation. Welcome, Abraham. It's great to be with you today. Let's dive in. So first, I'd love to hear a bit about why partnering with governments is essential in the pursuit of building strong community health systems.
Thank you very much, Mallika. Partnering with governments is really central to delivering community health programs. Community health is driven by government and delivered by government is most effective and sustainable. This is especially true in Ethiopia, where government pays salaries of community health workers, we call them health extension workers in Ethiopia, develops policies and manages implementation. Without government, this will all be impossible. And having a model, a sustainable model for reaching universal healthcare would be impossible. As Lisha mentioned, Last Mile Health is working in 4 countries. And in these countries, governments have shown commitment to community health programs and community health workers, even though they are at different stages of implementation. In Ethiopia, we have 40,000 health extension workers who are salaried and managed by government. And this has been implemented since 2003, which is almost 15 years. Whereas in Sierra Leone, the government is trying to professionalize community health workers. So though they are at different stages of implementing community health programs, they're all working towards optimizing 6 S's with the support of Last Mile Health. So the role of government is absolutely central to implementing effective community health programs.
Thanks, Abraham. Maybe we can double click on your last point. Because Last Mile Health is committed to responding to needs of government partners, we've talked a bit about the 6 S's in our introduction of our strategic plan. But what does this specifically look like in Ethiopia?
Well, in Ethiopia, our work is in partnership with government and responding to the request of government. First of all, when we started our work in Ethiopia, the #1 priority was to align with existing national plans and programs. The government has established a 15-year roadmap for its community health program, and our programming has been aligned with those priorities. A very important point to this is also identifying key champions within the ministries of health. In Ethiopia, Minister Leah and the Director of Primary Health Care, Israel, are key partners and champions to our work. Our work has focused on upskilling community health workers, but we now have a 3-year strategic plan which expands beyond upskilling and goes into the other 6 S's.
Great. Well, for my last question, let's focus a bit on upskilling. I know that in Ethiopia, Last Mile Health has really focused on blended training. So blended meaning digital and paper-based training. We developed that in partnership with the Ministry of Health. How did that training respond to the priorities of the government? And how did that respond to specific training needs of health extension workers?
Well, as I mentioned, Ethiopia's health succession program is, 15 years old. And in the past 15 years, the government has depended on face-to-face trainings, which have proved to be very expensive. Not only that, face-to-face trainings usually don't use any form of technology, which really compromises their efficiency. So the ministry called on us to improve and transform this process. That's how we came up with a blended form of training, which costs less and also uses modern technology to improve and facilitate learning and improve knowledge and skill transfers. We are using effective methods for training delivery, such as using multimedia materials and also using technology to capture data and use real-time data for decision-making as training is happening. This has also dramatically reduced the cost of training. The blended approach is around 39% cheaper than the conventional face-to-face approaches. So this was done in a small scale, but after producing evidence and seeing its effectiveness, the Ministry of Health now wants to scale it up nationally, which we are very happy about. I can pass on to you to show a video with testimonials of our community health workers of how this blended training is adding value to their day-to-day work.
Great. Thanks so much, Abraham.
ከሌላዎቹ ስልጠናዎች ምናልባት እነኛን ስልጠናዎች ሰልጥነን ወደ ቤት ይሆናል የምንገባው ምክንያቱም ሞጁሉን ራሱ አንዳንዴ ሳንቀበል ወደ ቤት እንሄዳለን ይሄ ግን ስልክ ስለሆነ ቪዲዮም ታሪኮቹም ስለሚያጓጓ በድራማ ነገር የተዘጋጀ ነገር ያጓጓል እንድትማሪበት ያደርጋል ወደ ውስጥሽ እንድትወስጁ እንድትቀበዩ ያነሳሳል
ይሄ አዲስ ቴክኖሎጂ ነው ወደዚህ አዲስ ቴክኖሎጂ ሜድ እንደዚህ ቀላል መስሎ አይታየኝም ነበር ከኔ አንፃር እኔ መቶ ገጽ ያገላበጥኩኝ እዛ ወረቀት ላይ ያሰመርኩኝ በቀይ በሰማያዊ ያሰመርኩኝ የዛ ጊዜ ነው ጥናትና ትምህርት ማለት ታሬ በቀላሉ አንድ ፓድ እንዲተገለጠ በማንኛውም ሰዓት ላይ ምንማረው ይሄንን ቴክኖሎጂ እኔ በቀላሉ ወደ ሄልዝ ኤክስቴንሽን በማግኘት በጣም ደስተኛ ነኝ
ደስ የሚል ነበር እየሰለጠንን ፕራክቲስ እዛው ህዝቡ ላይ እየሰራን ስልጠናው ላይ ሆነሽ ፕራክቲስ የምታደርጊው ወይ ከአንዷ ጓደኛሽ ጋር ነው የሚሆነው ምናምንና ይሄ ግን ህዝቡ ቀጥታው የሚመለከተው አካል ጋር ስለነበረ ደስ ይል ነበር
መጀመሪያ ድሮ ምን ሰለጥነው በእንግሊዘኛ ብቻ ነው ሞጁሎቹ የሚሰጠን በእንግሊዘኛ ነው የማይገባን ቦታ ዝም ብለን እናልፈ ነበር አሁን ግን በመናቀውም ስለሆነ ተመችቶናል
አንዷን ፓኬጅ ብቻ ሳይሆን ሁሉንም ፓኬጅ በዚህ መልኩ ቢያቅፍና ቢዘጋጅ በጣም ጥሩ ነው ማለት እና በጣም አሪፍ ነበር
ትሬኒንጎች ወስደናል ግን እንደዚህ መሰለና በጣም የሚያምር ትሬኒንግ ወስደናል
ለሁሉም ደስ ብሎታል እዚህ ያመጡት በጣም ደስ ብሎናል አእምሮአችንን ፍሬ የሚያደርግና ስራን የሚያቀላጥፍ ነው
It's great to see that work come to life through that video. So thank you to the health extension workers who are featured in that video and at large to health extension workers in Ethiopia who are such a critical backbone of the community health system. I'm now really excited to dive into the next topic with my good friend and colleague, Chen. Nan and I have worked together for the last 7 years, and I'm thrilled we'll have the opportunity to hear from him around our influence strategic pillar. It was recently announced that through his work at Last Mile Health, Nan will serve as the co-executive director of the new Africa Frontline First initiative. Nan most recently served as managing director of our health system strengthening team, advancing Last Mile Health's global work to understanding what works and why in community health programs. Welcome, Nan. First, congratulations on your new role. Let's start by introducing folks to Africa Frontline First. Tell us a little bit more about it and how did it come to be?
Thanks, Mallika. Yeah, it's really great to be here. And it's kind of funny, one of the first roles that I had at Last Mile Health 7 years ago was writing the investment case for Liberia's community health worker program. I see Tamba is actually in the call today. So Tamba, I remember being in your office, probably pestering you, bothering you way too much, trying to figure out, which costs go in and out of the investment case and trying to mobilize resources for the Liberian community health worker program. So as you said, Mallika, the influence work here for Last Mile Health, the Africa Frontline First initiative is about influencing funding and practice writ large for community health. So while my role at the Africa Frontline First initiative just started this past week, the actual idea was seeded quite a while back. In 2020, at the beginning of the COVID-19 pandemic, President Ellen Johnson Sirleaf, who was such a huge champion for health systems and health workforce in Liberia, she convened a group of us, which included Last Mile Health, included the Financing Alliance for Health. And in that meeting, we were talking and discussing and felt like we were in almost like a repeat moment, a deja vu moment, where in 2014, 2015, the Ebola epidemic in Liberia was a total nightmare. But it was also a turning point for commitment toward rebuilding Liberia's health infrastructure. And in that aftermath, Liberia reinvigorated its health system. It built that new professionalized community health worker program that Tamba mentioned in the chat here. And so that was a real turning point. Fast forward to 2020, President Sirleaf was remarking that the world is in that same nightmare. And the real question for all of us is, will it also be a wake-up call? A wake-up call to invest in the front lines of disease detection and everyday health, which is the community health workforce. And as you might imagine, when President Sirleaf makes a call to action, you really have no choice to answer. So one reason why she's such a powerful champion and voice of this movement. But with that animating question from her, we began working on what would eventually become the Africa Frontline First initiative. The goals of which are to professionalize 200,000 community health workers in 10 countries in Africa by 2030, and to strengthen and sustain those same community health systems, which is those same successes that you and Lisha and Abraham were talking about earlier today. So we've been working with a number of partners like the Financing Alliance and the Community Health Impact Coalition, and of course, Her Excellency over these last 2 years. We've had some early and exciting successes with a catalytic fund that was launched, hosted by the Global Fund. We're hoping to build on some of that this coming year as well, and to heed really that wake-up call and to turn this vision of integrated and professionalized community health into a reality.
So it sounds like timing is everything. So I think you've talked a little bit about why Africa Frontline First now, coming out of two major kind of global health crises, but why is Last Mile Health growing in this direction?
Yeah, that's a really good question. I think the short story here for me is this is about accelerating the pace of change that's needed in community health from multiple parts of the ecosystem. And so maybe I'll just repeat that. Like, it's about accelerating the pace of change. We got to go faster. To meet the SDG targets, to meet targets like the 2 million community health worker targets that are set by the African Union. We have to accelerate the pace of change, but for multiple parts of the ecosystem. So what does that mean in English outside of the academic jargon? These ecosystems components are things like how much money is available at a country level to allocate, to earmark, to invest in community health. How does that money flow through from domestic or donor institutions down to and into country level, to partners, to subnational districts? How does the money flow? How does it get prioritized? Who gets to decide what is a priority? Who sets the agenda? How it gets measured? Can we even count the number of community health workers in the countries we work in, and how, or what services are they providing, and how are they getting supported. All those ecosystems components, if we're able to tweak or maybe even dramatically shift some of those in favor of integrated community health, those 6 S's that we've mentioned, in favor of equity, that can dramatically change and accelerate how fast each of the countries get moved toward those their visions that they've set. Maybe to get out of the abstract for a second, last month, I was able to spend a day with a community health worker named Patrick Malachi. We were in Kenya. I got to walk alongside him as we visited his household. And to me, it was clear that even beyond the clinical knowledge he has, or the training and the tools and equipment, which are all critical, Patrick's strongest asset was the trust that his community had in him. And that's irreplaceable. They knew him, he knew them, they were asking him questions, sometimes very personal questions. And that trust is, as we've seen over these last few years, is one of the most irreplaceable and scarcest assets that we have in primary healthcare. So when I sat down with him and his colleagues at the end of the day to ask what they needed, what could help them, it was the same response that I've heard for nearly a decade in rural Liberia, districts of Malawi, and other places: just consistent payment, get us supportive supervision, consistent supervision, get us the supplies we need, and recognize us for our work. So success to me looks, in this case, is ensuring that dignified work for health workers like Patrick are delivering for all of us on UHC. It's that daring quest that Soji mentioned at the beginning. So we need to make all this happen at a faster pace. And that's why we need to address this from multiple angles, at the country level, like Abraham just talked about, and also these regional and global initiatives.
And it sounds like, I mean, Africa Frontline First is unique in that it's a team of teams. And so the initiative relies on collaboration of core partners. I think some of those you started to mention during my first question. Those are Financing Alliance for Health, the Community Health Impact Coalition, the Community Health Acceleration Partnership, and Last Mile Health, and of course, many valuable partners across the community health space. Can you talk a little bit about why radical collaboration is so important and how that's being approached in the Africa Frontline First initiative? Yeah, absolutely. So collaboration has been part and parcel of Last Mile Health's DNA for a long time. It's through all of our work, but it is especially necessary for this type of work with the Africa Frontline First initiative, or when we're doing these kinds of ecosystems plays. So maybe to answer your question a little indirectly, it's November. One of my favorite US holidays is coming up this month, which is Thanksgiving. And what I love about it is, like many holidays across the world, it's a big feast and everybody brings a dish. There's green beans and sweet potatoes and savory potatoes, gravy. If you're in my household, we're often putting in an Asian dish along the way. There's always a turkey, which is too dry, and I don't know why people still eat turkey, but we keep doing this. But the point here is no one dish makes for the complete meal for Thanksgiving. It's all about how they combine together, and more importantly, it's about the people coming to the table to break bread together. And that sort of jargony health finance ecosystems problem I talked about earlier, about how financing flows and who gets to make decisions. That's this meal. That's the Thanksgiving meal. We need to all bring our own dishes, and all the people need to be at the table, or else it's not a complete meal. So for Africa Frontline First, each partner can bring their own special dish. As you said, the Financing Alliance has this really deep experience working with governments to mobilize resources and spend them effectively. The Community Health Impact Coalition is an amazing network of 40+ organizations sharing best practice, conducting joint research, doing joint advocacy, and using their collective voice to advocate for things like paying community health workers. Last Mile Health, we've got that track record in accompanying governments to build, design, and deploy these community health systems from the ground up. And for this type of collaboration, for Last Mile Health, part of the work is not just bringing your own dish to the table, but making sure that table is set for everybody. So a lot of the, what might be called collaborative overhead or coordination, or making sure that we are all aligned to that agenda and that everybody has a seat at the table. That's the work that we're doing in collaboration. Beyond some of those partners we were just talking about, we're also, of course, have worked a lot with last year
in the last year with the Global Fund on the Catalytic Fund. We're working with the African Union and Africa CDC in their mandate to set the agenda and the technical agenda for the continent. And so it's a pretty diverse and eclectic meal we're putting together, but it's the kind of collaboration that's always been in Last Mile Health DNA. It's necessary to achieve that daring quest that Cody talked about. And I couldn't be more proud to and just privileged to be able to contribute and work in this way.
Thanks so much, Nan. Congrats on your new role again. We're really excited for you and for the success of AFF over the coming years, especially in closing that funding gap together through radical collaboration. I think if you want to learn more about AFF, Shavana shared some resources in the chat, and I think everyone now has some food for thought as those who celebrate Thanksgiving that time nears. Great. Well, to transition us, I'm very excited to speak next with Yawson. She's our Managing Director of Operational Services. Na develops operational services for our country programs across Africa and serves as the head of our new Ghana office. Prior to joining us at Last Mile Health, Na served as the Ghana country manager for Zipline. Na, welcome. Great to have you. My first question for you is, in 2021, Last Mile Health reformed its operating model to put countries at the center of our work and shift power and decision-making closer to our programming. To put those commitments into action, we have since launched a global office in Accra. Could you tell us a little bit more about this office?
Yeah, thank you so much, Mallika. And I'm very excited to be joining Last Mile at this very exciting time. So just digging into the Ghana office. So we launched the Ghana office April this year. It was very exciting for us to see that vision take off. And the purpose of the Ghana office is to serve as a global base for our staff who will be supporting very critical work in our programmatic countries. So Ghana is a very strategic location because it will allow us to bring the much needed support within reach of the teams we serve. And this is a very critical part of our strategy. The new office would also foster collaboration among teams, foster coordination as well. And this is something that would really help us scale our work across the countries. I think another exciting part of having the Ghana office is it highlights our commitment to diversity, equity, and inclusion by moving the power away from traditional NGO headquarters, which are usually based in the US, and bringing that into Africa, and where we'll be able to raise and equip leaders who would lead key global strategies. And this would enable us to bring that diversity in experience, culture to play in our work. And this is something that we are very excited about and we are very proud about, and I'm excited about to be leading for our team. Yeah.
Thanks, Na. So in addition to shifting some of these centers of decision-making, Last Mile Health is striving to create an environment that promotes and sustains diversity, equity, inclusion. You started to touch on it, but can we go a bit into the work over the past year that the organization is pursuing?
Absolutely. So over the years, the past year, we've been very focused on building the proportion of cross-program teams that are based in Africa. And to continue to make that a reality, we just hired our director of talent who will be based in Ghana to bring a lot of those experience and talent back onto the team. And this is something that we are very excited about. I think another thing we are really excited about is having to welcome in a couple of months our Chief Technical Officer, who will be based in Ghana and leading a lot of the global technical strategies for our programmatic countries. And this is something that we are really excited about. And recruitment for that is actually ongoing in Ghana. I think key for me and personally what resonates with me a lot is that we are not just building a very diverse team where we have people with different experiences, different cultural contexts from within the continent, but we are also creating that environment that allows them to be successful in their work. So when you have a team that is very diverse in culture, there's an ability for things to not be sustainable. But by investing in our environments that allows us to have the diversity succeed, we are doing a good job about scaling it. And so what we are committed to and what we've been doing over the past year is partnering with our facilitators at the Better organization to create and deliver on a 10-part DEI training for all our staff. And I'm proud to say that nearly 90% of our staff have trained on that and have completed the training on it. And I think personally, I took that training, and what had resonated a lot with me is some of the topics that we discussed during those trainings. Things around psychological safety, things around cultural competence, that has come to play a lot in my work as I started with Last Mile. And I think this would enrich a lot of the work we do and help us scale a lot of the collaboration and coordination we want to see when it comes to building a diverse team. And that's something that we are really proud of. Yeah.
So one element of diversity, equity, inclusion is some of the work that the organization has undertaken. Another part is to think about how we integrate gender equity into our programmatic work. I know that's something that Last Mile Health has been deeply thinking about over the course of the last few years, and we've made some meaningful progress at the organization in this regard. Would you be able to talk a little bit about our gender equity work?
Sure, definitely. And that's one of the things I'm also excited and proud about. Over the past year in Liberia, we've been working with our partners there to improve gender equity in the National Community Health Assistance Program. One interesting fact is that though women make up about 70% of the global workforce, in Liberia in particular, less than 20% of the professional community health workers are women. And this often happens when there's a transition from having a women who are working as volunteers to professional permanent workers. A lot of the policies and the systems put women at a disadvantage. And so what we have been doing with the Ministry of Health and the partners there is to ensure that there are policies, there are systems that are put in place that allows for good women representation when it comes to the paid or professional community health workers. And this has shown a lot of results over the past year. And we are very proud to see the skill as our team in Liberia continues to work with the Ministry of Health on this. And this is something that we are really grateful to the team in Liberia and also to the Ministry of Health for their support in making this a reality. Yeah.
Thanks so much, Na. It was great to hear about the work the organization is undertaking. I know this work is not easy and it takes time, but we're really grateful to our teams at Last Mile Health, our Ministry of Health counterparts, and all of our partners, I think, who walk alongside of us to advance this important mission. I think that closes this part of our launch. Thank you to all of our speakers for your insights, your experiences, your humor. I hope you'll take some of that as you leave this call. Lisha, I'm going to hand it over to you to close us out.
Thanks so much, Mallika. It's been so great to hear from each of you. Thank you. I think not to mute. Am I unmuted now? Thumbs up. Good. Good for the comic relief. Thank you, Mallika. It's been so good to hear from you all. I am just really grateful and inspired to work with such a talented team and group of leaders. I hope that each of you on this call are as inspired as I am by the colleagues that you've heard from today and by the enduring commitment of the Last Mile Health staff, our board, our advisors, our government, and donor partners. Most of all, I would say I'm inspired by the health workers that you saw testimonial from, like Serena and Emmanuel and Diana, and that I see in action every day in Liberia, Sierra Leone, Malawi, and Ethiopia and beyond. Throughout the pandemic, these community health workers kept showing up for their patients in the face of incredible obstacles. I urge all of us to keep showing up for them. As we emerge from the COVID-19 pandemic, the global community is increasingly turning its attention towards other pressing crises. There's not a day that goes by that you're not sort of seeing really concerning headlines in papers and in news articles. We're seeing well-deserved attention being brought to issues of climate change and economic growth, the continued conflict in Ukraine. These issues and many others are critically important and appropriately top of mind. And at the same time, I firmly believe that the challenges that lie ahead cannot be solved if 2 billion people around the world remain beyond reach of basic healthcare. Progress requires healthy communities and communities that are able to advocate for their needs and then hold those in power accountable. And it requires us to keep this key lesson of the pandemic in mind, that the health of any one of us is connected to the health and well-being of all of us. There is no them, there is only us. I believe that now is the moment to invest in a critical path forward for exemplary community health systems in pursuit of universal health coverage. And a lot of what you've heard my colleagues talk about today. As Peter Sands, who leads the Global Fund, recently captured so well, quote, equipping professional community health workers is probably the single most powerful lever we can pull, end quote. And we know that this works. We need to scale this solution by investing in community health workers like Serena and Workanish and Patrick. And as my esteemed colleagues Soji mentioned earlier, this work is a daring quest. Success is not guaranteed. And the scope of the challenge before us is enormous, but so is our resolve. We have the solution in our hands, and our challenge now is to stay the course, to invest the resources and the long-term commitments needed to see the work through. If we do so, we can close the distance to care and save the lives of millions of infants, children, and mothers in the last mile. So thank you. We look forward to this work with you over the coming 5 years. Thank you for joining us today and for standing with us in the journey ahead. You all. Be well, keep up the good work.